If you are newly diagnosed with Parkinson's and you're struggling to navigate treatment options, we would always advise that the first point of contact needs to be your clinician. It varies how accessible different clinicians are, but you can always contact your GP as a first point of contact. Your Parkinson's nurse should be able to help you with this, or your consultant. And there's also the Parkinson's UK helpline where you can speak to a Parkinson's specialist nurse.
Medication and treatment for people living with Parkinson depend on the variety of factors. In particular, for patients newly diagnosed with the condition, the first factor depends on the stage of the disease when they are able to meet the consultant neurologist. Not always it is indicated to start a medication soon after the diagnosis. It depends on the severity of the symptoms. Usually for people with a new diagnosis of Parkinson's, medication called dopamine agonist or levodopa are the first line. However, the dose, the number of time to take over the day, the milligrams of each medication change massively on the base of the person, because the key point to be successful in the therapy of this condition is to personalize the therapy. There is no benefit to start the current available therapy and medication straight away. Indeed, we don't have a cure for the condition, and I always explain to the patients in clinic that or we start the medication the day of the diagnosis or we start a year later, this will not change, unfortunately, the disease progression. My practical question is how much the tremor, the slowness impact on the daily life. And if the patients arrive in clinic with a very mild symptoms and they answer to me that these symptoms do not affect significantly the daily life, I usually wait to start the medication, and I book a further follow-up in 6-8 months to make a decision on the basis of the progression. The reason of my conservative approach is because medications are also associated to side effects. However, it is important to consider the social impact of the symptoms, not only the functional impacts. There are patients with a very mild tremor. However, they are feeling so embarrassed to go out, to socialize, and they started to be isolated. In that case, even a mild tremor should be treated straight away after the diagnosis. I usually use, for example, the quality of life questionnaire to monitor how much the patients feel the benefit. So my practical question usually has, are you back to your hobbies? Are you back to go out for dinner with your friends? How do you feel?
No two people who have Parkinson's experience the same journey. No two people have the same symptoms. No two people require the same treatment. But we hope that these videos will help inform you to be able to choose what works for you and what doesn't work for you, because there's no right or wrong way. It's just about finding the tools and the resources that are best for you.